Good evening. My name is Katrina Moog, and I am responding to an assignment of which I am a nursing administrator and are being tasked with handling staffing shortages that have reached 25%, which means 1 in 4 nurses are leaving for whatever reason. I'm also being asked to share my thoughts with the CEO because the minimum staffing requirements are expected to decrease, and they are expecting our turnover rates to reach 35%. So this is what I have gathered. Unfortunately, this is a problem all too real for nurses and nursing leadership. A 25% turnover would mean that 1 in 4 nurses leave for whatever reason. As an administrator, there are many options. The first step would be to determine how many open positions are available and immediately outsource with local talent agencies and local recruitment agencies to be sure that they can blast out flyers for these open positions to nurses in Virginia. The next step would be to increase the presence of leadership throughout the hospital in all shifts. The leadership does not have to be clinical to come in and help. Tasking and answering call lights can be a great help and does not require a license or a great deal of clinical expertise. Such things as filling ice pitchers, handing someone a remote, helping them order a meal tray can take a great amount of time and can take away from a nurse's need to administer medicines or do other things that do require a clinical license. Next, I would determine what the staffing ratios are and work with local travel and staffing agencies to ensure that we are meeting the needs of patients with acceptable ratios. Being aware of the minimum staffing ratios that are being enforced, I would certainly stay educated and in touch with other local hospitals to see how they are handling the staffing crisis as well. I would also create a staffing workforce. This team would represent licensed and unlicensed staff and we would meet monthly or even as soon as every 2 weeks, and I would ask the team to provide me feedback with the biggest challenges they see from day to day, and also ask them why they think people are leaving and what makes them want to stay. Based upon what they divulge would yield my next move. If it is leadership's presence and support that they would want to see, or following up on patient complaints more, or whatever they claim to need help with, I will work very hard to ensure that they feel their voices are being heard and acted upon. I would keep notes from this meeting, and I would keep executive leadership aware of what they are faced with on a daily basis and what their biggest challenges are. I would also share the feedback from the staff with the Learning and Retention Shared Governance Council. The staffing shortages are not expected to improve, as we learned in this article, so we must focus on the retention of the staff we have and, in addition, strengthen our efforts for recruitment. I would also ask the Human Resources Department to call back the last 10 nurses and nursing assistants to meet and discuss options of returning and to discuss why they left. I would also review the exit interviews for staff that have already completed them. During this entire process, I would offer an open door policy for staff to come in at any time to share concerns and to offer any advice of recruitment and retention and how administration can continue to help them. I would also be compassionate about their needs and serve the team as not only their leader, but as a comfort to them during stressful times. Lastly, I would ask for a meeting with the CEO and have data ready to present. I would review the last 6 months of safety reports involving patients with near misses and also any events where harm reached the patient that we can attribute to staffing shortages. If 5 out of 10 injuries were related to falls due to low staffing ratios, then I would encourage the CEO to support the above initiatives and to consider this as a staffing crisis. I would also ask that the CEO attend the next staff meeting and speak upon the efforts of the organization to strive for satisfaction within the workplace and to make the workplace an enjoyable and safe environment. Hopefully, by the CEO being present at this meeting, the staff will see that leadership are aware of the staffing crisis and are putting all focus and efforts towards improving the current ratios. It will be very important that the CEO be more present throughout the hospital. Staff needs to see that they are not being left by themselves to handle these situations. I would let the CEO know all of the above action items and ask for his or her support in expediting the process. Minimum staffing requirements are important for legislation, but it will be my job to let the CEO know that we have to set our own staffing ratios based upon our patients' needs. Thank you.